Hi, it's Andrea again, and the next thing we're going to talk about is the acute phase. So that's when you first have injured your ankle after you've sprained it and you have a lot of swelling. So the first thing is, depending on the extent of your injury, you may be put in a boot, and the boot restricts motion because we want to make sure, like I said before, you can't change once a ligament is stretched, but this allows the ligament to heal better. Because instead of it, if we keep moving it, it could be healed like this, and then putting it in the boot, it will at least create scar tissue to prevent the less integrity of the joint, lack of integrity of the joint. So that's the boot. And I also recommend, when you're in the boot, is to single-legged stationary bike. So to have the boot actually up on the handlebars of a stationary bicycle and pedaling with the good leg, because there are studies that show that the oxygenated blood gets distributed throughout the body, including the injured leg, to help with healing. So again, single-legged biking with the boot on top, that way you don't lose any cardio. The second thing you can do is you can compress it. So if you get a horseshoe and you get a tensor, and so the idea behind this is it's going to compress to help get rid of the swelling, because it's really important to get rid of the swelling. Swelling is normal, but if we have a lot of swelling, we lack range of motion in the ankle joint. So the idea is you get the horseshoe right underneath the fibula, so right underneath the fibula head. Then you take your tensor, and you're going to start at the foot, and you're going to wrap it at the foot. What you don't want to do is you want it tight, but you don't want it too tight, because if it's too tight, your foot is going to go, you're going to lose the circulation of your foot, and it's going to go white. So, and I recommend getting some help if you've never done this before, because doing this on your own can be quite challenging. So I go around the ankle under the foot, and then around the ankle again, and then I just keep weaving it up the leg. So this creates some tension and helps to get rid of the swelling, and creates a little bit of stability in the joint. So it looks like that. Now, another thing is an ASO brace, and an ASO brace is a brace that is similar to an actual ankle tape job, and it creates stability in the joint, but it also creates compression and helps with healing. And so I'm a huge proponent in moving when you're injured. And so with the lesser of the sprains, I get them in an ASO brace with no tension on the bike, so they can't move the joint too much. And then it helps decrease swelling and helps with healing of the injury. And I get them to do it about 10 minutes as a warm-up to help with the actual rehabilitative. And so these are some things I also did with my fractured foot as well. Then also, I believe in contrast baths. So what happens is you get a bucket of hot water and a bucket of cold water, or a bin with cold water, and put ice in it as well, so whatever you can manage or handle. Then the idea is I like to start with hot to open up the blood vessels. So I put the foot in for hot water for like a minute, and then after a minute, you put it into cold water, and then you switch between the two. So for a total of 10 minutes, so 5 minutes alternating each one. If you find it too unbearable, I put a wool sock on to kind of decrease the intensity. I have Raynaud's, and Raynaud's is you're allergic to the cold, so it can be quite painful. So if people have Raynaud's, try a wool sock with that, and that can help. And so that's kind of in the acute phase. You can't really do much, because one, you're probably not going to be bearing weight too much depending on the extent of the injury, and we just want to get rid of the swelling.